June is Men's Health Awareness Month, and this week we're focusing on heart health. Heart disease is the #1 cause of death in the U.S., the #1 cause.
But what makes doctors so frustrated is heart disease is very much preventable. Joining us now is Dr. Mohammad Pashmforoush. Hope I said that correct,
Absolutely.
Okay, correctly. From Tri-City Medical Center. And doctor, from what the data shows us, tells us that many men are reluctant to get checkups because, here's my question, are they afraid that they might hear something bad about their heart?
Well, I mean, I guess that's certainly true. However, as you know, as you mentioned, cardiac disease is a major cause of mortality and morbidity in our society. And a lot of people are not aware of the actual consequences. And we know we have had several celebrities having cardiac sudden death, and they have had arrhythmias. And of course, cardiovascular disease is a major issue in our society. It's a huge cost.
And obesity is a big cause of that, right?
Absolutely. It has to do with the fact that we have mostly a sedentary lifestyle, in addition to the fact that we're not exercising as often, eating a lot of fatty foods. High caloric intake is a major contributing factor to the heart disease.
That's what's so frustrating, is because if you get in control of your obesity, if you watch what you eat, if you make sure you exercise 30 minutes a day, you can prevent heart disease.
To some extent. I think actually diet and exercise is very important. However, you have to see your physician. And in addition to the cardiovascular disease, which is a leading cause of morbidity, mortality, death, and suffering among the men and women, there's also another component to this, and that's arrhythmia. In fact, arrhythmias, I'm an arrhythmia specialist, is a major cause of sudden cardiac death. The heart attack itself does not typically result in the patient. It's actually the arrhythmia that ensues after that. And I think it's not just a cardiac arrhythmia that causes the mortality, but this congestive heart failure ensuing cardiac damage. But being an arrhythmia specialist, I'm mostly cognizant of the fact that most of the young people, young individuals, have arrhythmias presenting as palpitations, presenting as shortness of breath, dizziness and lightheadedness, and they're not aware of it. And that's very important. In fact, a lot of our known celebrities and politicians, Tony Blair, George W. Bush, and many people have atrial fibrillation, which is very common in cardiovascular disease.
Well, that leads to my next question then. Is there an age where men have kind of crossed the Rubicon where they should be concerned about heart health, or are you basically saying it can happen at any time then, right?
It could happen, and in fact, we have had significant information coming from American College of Cardiology and American Heart Association. The recommendations are even at age 20, you should go see a physician and get a sort of a profile of your cardiovascular risk factors. And hypertension, obesity, diabetes, mellitus, your blood glucose level, etc. That is a major contributing factor to cardiovascular disease. And you should at least see a physician as early as 20s and get an EKG. And if you're having symptoms, definitely see a physician.
Okay, so what I'm hearing is go to the doctor, get regular screenings, watch what you eat, exercise. But what about vitamins? I hear fish oil is really good for you. And I also hear that maybe red wine, a glass of red wine.
Well, definitely. I think the most critical factor is dietary caloric restrictions, meaning reduced intake of food and calories. Now, there are fads in medicine, and I think maybe some of the vitamins that are advertised out there, they're overplayed. What is clear, however, antioxidants like vitamin C, vitamin E, have a direct correlation with increasing longevity. And they make a lot of sense. I'm not so confident about taking fish oil. However, there are some valid studies supporting that. Whether it's a scientific fact, it remains to be proven.
Doctor, thank you so much for coming down on a Saturday night.
Absolutely.
Yeah, we appreciate it.
Thanks for having me. I appreciate it.
Thank you, sir.
Sure.
Thank you very much, Doctor.